have a model of an infant skull. The white aspect of it, this is all bone, and the blue is membranous. It's membrane. So the soft spot we hear about on babies' heads that we can sometimes see the pulse is this part right here. So the bones have not met, they do not fuse, but they do eventually meet like pieces of a puzzle that come together, and they should be able to move and slide a little bit, even into adulthood. And you don't want any aspect of the sutures in the adult skull to stick and get stuck. So if we open up, this one does not open up, but this one does, and we take a look inside the skull. This is the vault of the head. This is the base of the head. The pink bone is your sphenoid, and the brown bone is your occiput. Together they come together to form the spheno-basilar symphysis, and it's pretty much in the center of the head. It sits underneath the brain. On top of it is the pituitary gland. And when osteopaths who do cranial work assess the head, this is one of the first joints we look at to make sure that it moves properly, that it flexes and extends or twists in a normal range of motion. If it does not, if there's a twist, inordinate twist, and possibly a twist, and then the joint stays that way, it can result in asymmetry of the periphery of the head. This can lead to some visual problems, hearing problems, malocclusion with biting, feeding issues like reflux, or difficulty latching onto a nipple, all of which can affect the thriving of a baby. Your orange bones here are your temporal bones, which house the eardrum, the ear canal. Your blue here is the frontal bone. And then the green bones here are your parietal bones. If you put that back on, you can see it's the top of the head. So with osteopathic craniosacral manipulation, we not only look at how well these joints move together, because you don't want any part of it to stick and not move. And also within the cranium, there's a dural system. It's like a lining of the head. So we evaluate how well does this lining move in addition to the joints of the skull. Think of a lining in a skirt. If you pull too hard on the lining in a skirt or in a pair of pants, it will move the fabric on top. And you don't want asymmetrical or inordinate amount of pulling on that dura inside the skull.
What happens when the baby goes through the canal? What may happen to
The cranial bones, the sphenoid. So if the baby is passing through the pelvic, the canal, the birth canal, and there can be, again, some misshaping of the head if there are appliances in there to help the baby come out, or hands, or perhaps the pelvic bone, the pelvic opening is just too small for the size of the baby, you can get a certain amount of pressure and squishing of the head as it comes through. Now, a certain degree of that is normal, and you want that compression, which kind of jump starts the nervous system, because if the head is realizing I'm being born, and then as it comes out of the hole, you get a release and kind of like a jump start of the CRI, or the primary respiratory mechanism. So if there's a misshapenness of the head as it after it comes through, it can lead to all the feeding issues and visual and hearing problems later if not addressed. Does that answer your question?
Thank you.